Thank you so much. Thank you so much. So, good evening, everyone. Myself, Dr. Tanema Singhal. So, it's a pleasure to be here at TEDx speaking about a topic which is profoundly important but often overlooked: healthcare burnout. Being in the field of women and child health for more than a decade, working as a pregnancy educator and a lactation consultant, I very well understand how critical this topic is. So today, as we delve into this topic, I will try to shed light on this and will also give some actionable strategies to how to combat it. So, understanding healthcare burnout. Healthcare burnout is more than just a buzzword. It's a critical issue that impacts the very individuals who are at the forefront of caring for others. Healthcare burnout is characterized by feeling emotionally drained, detached from their work, and decreased sense of personal achievement. This leads to physical tiredness, emotional distance, and a feeling of not being good enough. Let us look some statistics. According to a 2022 study by JAMA Network Open, around 50% of physicians reported symptoms of burnout. Now, this is a huge figure when we talk about patient care and provider well-being. As per, as per a survey by American Nurses Association, around 70% of nurses reported symptoms of burnout. And this is more typical in the units of critical care and emergency care units. These numbers show a crisis that requires our immediate attention. The burnout is a crisis and it hampers the decision making, it reduces the empathy, and it increases the chances of medical errors. This further worsens the situation because the healthcare provider who is already stressed, we feels more stressed, and this worsens the whole situation. Now let's understand the causes of burnout. Once we understand the causes of burnout, then we will be able to have some actionable strategies around it. So first is workload and work hours. Working long hours, seeing many patients, and also dealing with lot of paperwork can be too much. As per a study by Lancet in 2019, the healthcare providers who worked for 60 hours or more in a week, they felt more symptoms of burnout as compared to the people who worked for lesser hours. This study compared working hours with increased emotional exhaustion and decreased job satisfaction. Burnout contributes to higher incidences of patient safety and which increases the patient safety incidents. Emotional demands. Being around people who are sick, who are suffering is not easy. People who are demanding care every time, it becomes too hard sometimes for healthcare providers to deal with every day. According to Association of American Medical Colleges, it projects a shortfall of around 37,800 to 124,000 physicians by 2034. This is a huge number, and also contributing factors are population growth and also the aging physician workforce. Insufficient support. Getting insufficient support from the leaders and also not getting enough resources. This adds to the burnout. As per as per a survey by MedPage 20 in 2020, 1 in 3 physicians either plan to reduce their work or to change their profession completely. Now, this will bring further shortage of staff and it will bring more pressure on the people who are already in the field. Strategies to combat burnout. Before going into the strategies, let's understand a ratio of physician to population in India, which is 1 is to 900 and respectively. So this is a huge number for a physician to combat with such large number of population. So we have to have a multifaceted approach when we talk about strategies. Encouraging work-life balance. So allowing for flexibility. So allowing the healthcare providers to have some flexible timings for their work hours will be, this will help the healthcare providers to balance their work life and their personal life in a better way. Make time for rest. The helping staff, the juniors, they have extended duties for 24 to 36 hours in a day. So for them, it becomes so difficult, and it is 100% going to affect their health and their work. So regular rest periods should be given to them so that they can rest and recharge. Even studies say that rest periods are important for anybody to properly perform their duties, and also for a physical and mental well-being. Strengthen the support systems. We need to create supportive environment where healthcare providers are taken care, so that they can take care of the patients. Create a supportive environment where there should be peer supports, there should be mentorship programs and regular check-ins. Offer counseling and mental health services. So mental health resources should be easily accessible, and even people should be encouraged to use that. According to now, mental health of healthcare workers is at stake, not only because of the workload, but also because of the harassments done at the study places and the workplaces. A study done by CNN from 2018 till 2022, it cleared that around 44% of healthcare workers wanted to change their job because of this aspect. Simplifying administrative tasks. So using efficient systems, so including technology which can reduce the administrative work, streamlining the workflows and simplifying the documentation work will help the healthcare providers to save time for patient care. Delegating the non-essential tasks, the tasks which do not require medical expertise, which are at all administrative in nature, should be done by administrative people, and healthcare people can work for caring for their patients more. Support technology development. There have been many new discoveries in the medical field machinery, be it gynecology, be it cardiology, be it urology. Many complex surgeries have been performed by using machineries which have been simplified. If we look at last 12 years, 12,800 surgeries have been done by 500 trained surgeons. More professionals can be trained into this so that patients get faster and a safer and more effective treatments, and healthcare providers can better manage their time. Promote resilience and self-care. Encourage self-care practices like mindfulness, exercises, and adequate sleep. So self-care is not a luxury. It's a basic amenity which any human being require. According to a research done by Health Affairs in 2021, approximately 60% of healthcare workers reported symptoms of depression, of anxiety, or both during COVID-19 pandemic. This is a huge number, and we should understand the impact of mental health on even healthcare providers. Provide stress management training. Equip healthcare providers with tools like stress management, like relaxation techniques, mindfulness, so that they can balance their stress and work in a better way. Leadership and organizational changes. Engage leadership. Leaders should take time to talk to their workforces regularly, take their feedbacks, and plan out the strategies accordingly, so that healthcare providers are also taken care while they take care of the patients. Foster a positive work culture. Creating an environment which is positive is very much required which values transparency, mutual respect, and collaboration. So as we come to the conclusion part, we have to first understand that this issue of healthcare burnout is a serious issue which requires immediate attention. Once we understand the causes, we use the strategies which we have discussed, we implement those strategies, then we can plan to foster a healthier and more supportive work environment. As per a study by BMJ Quality and Safety 2020, the healthcare providers who show more symptoms of burnout, their chances of medical errors increase by 40%. So healthcare burnout is important not only for improving healthcare professionals, but also enhancing the quality of care which patients receive. When healthcare providers are supported, they are valued, they are empowered, they will be able to deliver the compassionate and high quality care which every patient deserves. As we move forward, let's commit to being part of the solution. Let's advocate for the changes. Let's support our healthcare providers. Let's recognize the profound impact they bring on the lives of which they touch every day, and let's make efforts to make differences in lives of not only healthcare providers, but in fact it will be helping the society as a whole. So thank you so much for listening to me with a patience, and let's hope to build a big, beautiful society. Thank you so much.